This is Dr. McDaniel at GYN Corner. Today is Wednesday, it's hump day, July 10th, and yesterday I spoke about Molluscum Contagiosum. I'm continuing that today. In brief, Molluscum Contagiosum is a skin infection. It's due to a virus called Molluscum Contagiosum, and it's a pox virus, a pox family of viruses. It's highly contagious with skin-to-skin contact. It's seen in two groups, either very young children, daycare, nursery age, and that's usually around the face, arms, legs, or around the mouth, face, arms, legs, and hands. Or it's seen in adults, predominantly in the genital area. And as I mentioned yesterday, I've seen it a couple times around the breast due to sexual activity with genitalia on a woman's breast. So for children, school-age daycare, as long as it's in those kind of general body parts, we know it's just due to one of the toddlers had the molluscum virus and spread it, playing with the other kids or sharing saliva and toys that they're all putting in their mouth. If it's an adult, it's always pretty much genital, and that's always going to be a sexual infection. It's from genital to genital contact with the molluscum. So molluscum is considered a sexually transmitted disease or a sexually transmitted infection for adults. Now, we don't have a way to test or to screen for molluscum. We don't have a blood test for it. We don't have a culture swab we can do for it. If someone is suspected of having molluscum and you need to confirm that diagnosis rather than just a visual diagnosis, the lesion or the growth or the bump has to be removed. So we take a scalpel, it's called an excisional biopsy, remove the bump, we send it to the pathology lab, and the pathology doctors are able to confirm that it's a molluscum infection that caused the growth. As I mentioned yesterday, molluscum looks like a very, very plump pink to slightly red or inflamed bump. It usually starts off as a very, very tiny little pinprick red dot or pink dot. Regardless of the person's skin tone, whether they're very, very snow white pale or they're very, very dark, for whatever reason, the molluscum bumps are always pinkish to reddish. They start off as little tiny pinprick pink or red dots, and then they swell up or enlarge, usually about 5 to 6 millimeters, so about the size of maybe like 2 sesame seeds if they're rounded. I've seen them get pretty large, up to the size of a BB shot or a small caper. If they continue to swell and grow, usually by the time they get to around a caper or so, they will often pop on their own, and then they'll dry up and shrivel up and go away. As I mentioned yesterday, you do not want to scratch them or try to squeeze them or pluck them off. The infection, the virus, lives in the material inside the bump, the kind of cheesy, pasty material inside the bump. So if you squeeze or scratch it, you will spread the infection to additional locations. Molluscum is a very slow-growing viral infection, so if I see someone with evidence of those bumps, I'll usually ask them if they had a new sexual contact about 2.5 to 3 months before they started noticing the bumps. That's about how long it takes if someone gets infected with molluscum. Their immune system is not strong enough to suppress the viral activity, so it flourishes. They get symptoms. That's about how long it takes from infection to symptoms, about 3 months or so. Excuse me. If someone comes in with molluscum and they want a treatment, there are a couple of ways to treat. But what I predominantly recommend is I always recommend that people take supplements for their immune system to try to get their immune system to fight the viral activity, suppress the viral activity, allow the lesions or the bumps that are there now to swell up, pop, and go away. It will take a while. It will usually take, on average, 6 to 8 weeks, even 3 to 4 months for the bumps to go away. But if you take the supplements for the immune system, they do tend to go away faster. So if you take the supplements, and I always recommend it's the top dog supplement is L-lysine. That's Lysine. L-lysine. It's an amino acid that helps support the immune system. 500 milligrams in the morning and 500 milligrams in the evening. Not 1,000 milligrams once a day. Not 500 milligrams, 2 tablets at the same time, but spread out. So in the morning and in the evening. That seems to work really, really well to strengthen the immune system. If someone does supplements for their immune system, the growths or the bumps do seem to go away faster than if just left on their own. So closer to that 6-week mark or so. If someone is resistant to doing the supplements, or they're, they get the heebie-jeebies, or they're grossed out by just seeing those bumps sitting there, or they're upset because they're starting to spread, they don't want to do the supplements, it's taking too long, then they can do a treatment. The first two options are if someone wants a treatment, the options are to freeze the lesions, or to burn them with acid, or to burn them with electricity cautery. So the freezing is called cryoablation. I have a nitrous oxide tank in my office. I have a little pinpoint adjustment tip that I apply to it, and then it's just like a second or 2 seconds of a dot to each growth, and then I let it melt, and then I do a second application. So the freezing does work, but sometimes it takes 2 applications. If I have to do 2 applications, I'll usually do them a week or 2 weeks apart. It does burn, ironically. The cold method does burn. The second option is acid, which I don't do anymore. I used to do years ago. Bichloroacetic acid or trichloroacetic acid. You put it on you take Vaseline to protect the skin. You apply the acid to the growths. That will pretty much always require a second treatment. And then the electricity, I don't do the electricity either. I think the freezing is the best of them. But the electricity is just cautery. Same story. We desiccate it and burn it. That will usually only require 1 treatment. If someone wants a treatment, I recommend, if they don't want to do the supplements, I recommend the freezing. That's the only one I'm comfortable doing. The other ones, I don't feel like they get better results in the freezing. I think the freezing gets the best results. You don't have any issues with scarring. Most of the time it only needs 1 application. Every blue moon, a repeat. So it works really well. If they come in and they want the freezing, I always remove 1 or 2 of those growths first, the biggest ones, and send them to the lab, because I like to have a black and white printed report documentation that what I'm destroying, getting rid of, is really a molluscum. Because I don't want someone down the road coming back saying that they had vulvar cancer and I burned the cancer and it came back and now they're dying. So for me, just as a way to confirm for the patient, confirm for me that the growths I'm looking at and diagnosing with my eyeballs are really molluscum. I remove 1 or 2, send them to the lab, they confirm the diagnosis, and then I'll do the freezing for the rest. The next option is a self-application. It's called Imiquad, or Aldara is the brand, and it's a gel that you apply directly to the growths. It garners the immune system to the area where it's been applied to fight the viral activity. Now, Aldara or Imiquad has been approved for genital wart treatment. It has not been approved by the FDA for Molluscum Contagiosum, so it is considered an off-label use, but it does work. It works slowly. I don't think it works any better than if people take supplements, but it's easier than having to take pills every day. For some people, just apply the gel. It's 3 times a week. Before you go to bed, you wash it off in the morning. But same story. It usually takes several weeks for it to go away. 6, 8, 10 weeks for it to go away for some people. If someone wants the Aldara, I do the same thing. I tell them I have to remove at least 1 of those molluscum, send it to the lab, confirm it's just molluscum, and then I write them the prescription for the Aldara, because if I'm doing a treatment, I want a confirmation in black and white objective confirmation that what I'm treating is actually what I'm saying that I'm treating. If they're going to do the supplements from the health food store to get their immune system fight it on their own, then I don't need a documentation because I'm not intervening in any ways on their behalf for those growths. And then obviously if they get fed up, they don't go away, or they get impatient, they can always come in. So, and then once the molluscum is treated, it goes away, they don't have any new growths for at least a 2.5 to 3 month time frame, then they're cleared. It can never come back because once it's gone, it's gone. But of course, someone can potentially get reinfected. So, sorry, I just have to answer this message really quickly. So I hope that's been helpful. This is Dr. McDaniel on Molluscum Contagiosum, a highly contagious skin infection that in adults is a sexual transmitted disease or a sexual transmitted infection. Please check out the YouTube channel. It's also called GYN Corner. Like, subscribe, and comment. And if you have questions or any topics that you'd like for me to speak on, please feel free to send me a messenger or to send a message through the YouTube channel, and I'll be more than happy to speak on those topics. Thanks again. Have a great rest of the day, and we'll be back tomorrow, Thursday.